So, Dr. V, I've done a lot of videos on women's exams, but tell me about the male perspective. What are some exams that men might have in more private areas, and why might you do them?
Well, I think that's one of the reasons why men don't come to the doctor as often as women because they're scared to death of having their prostate examined, which is understandable. It's an uncomfortable test, but it's not painful. We used to do it pretty routinely on most men to screen for prostate cancer, but some of the newer research is showing that there's really not a lot of reason to check a prostate. So I usually have a discussion with my male patients about whether that's something that they're concerned about, if they have a family history of prostate cancer, or if they're having any symptoms of prostate cancer, which would be obstruction to urine flow, getting up at night to urinate more than a couple times, decreased flow, trouble stopping after they urinate. I usually will check a prostate if they have symptoms like that. Some doctors won't. The United States Preventative Services Task Force and the American Cancer Society have both stated that prostate cancer screening actually causes more harm than good. So they don't recommend it anymore. I still do it. I've found a few prostate cancers on exam, so I think it's worth doing. It doesn't cost anything, but that's a discussion that you have to have with your doctor.
So, what is this exam actually like?
Well, that's a good question because I will tell you a story about one of my patients that I said, okay, I'm going to check your prostate now. And he bent over and I put my finger in his rectum and he just about turned around and smacked me and said, "What are you doing?" I said, "I told you I was going to check your prostate." And he said, "Well, I didn't know that's how you check it." So, so now I always tell him what's going to happen. Okay, basically, gloved finger with some lubricant, one finger into the rectum. I can feel the prostate, feel for nodules, feel for tenderness, feel for enlargement. And at the same time, I take the stool that's on the finger of the glove and test it for blood as a colon cancer screen.
Does that mean that your patient is going to poop on you?
I haven't been pooped on yet.
Excellent.
But it's obviously not pleasant for me either.
What are some other exams? What about a testicular exam? What is that for?
So, testicular cancer is a cancer of young men and usually teenagers. What we used to do is check, teenagers from the age of 12 to 20 or 30 for testicular cancer, which shows up as usually a non-tender hard nodule on one of the testicles. So it's a test that takes all of about 5 or 10 seconds. That's also come under fire lately with the American Cancer Society and the United States Preventative Services Task Force saying that there's no point in doing that. It has not resulted in a lower death rate from testicular cancer. If you're going to get testicular cancer, that's the best cancer to get because it's almost 100% curable. But it's a simple enough thing to do. They've also said that doing testicular self-exams is probably worthless. I disagree with that. It's something that's simple enough to do. Just check yourself. If you feel something that didn't used to be there, you should get it checked out. Because with any cancer, you do want to catch it as early as possible.
And getting it checked out, that means seeing a doctor, having an exam in the clinic, and then other imaging as well?
Yeah, we usually do an ultrasound. And if that shows that it looks like a cancer, then they'll recommend a biopsy. So I'll send you to a urologist. Sometimes they'll actually remove the whole testicle, which is okay. You're going to live just fine with one testicle. You can still father children and it won't make you impotent or cause any problems. They'll sometimes even put an implant in there just for cosmetic purposes. So you have 2 testes instead of just one.
Perfect. Well, thank you very much for your insights, Dr. V.
Sure.